Nowadays, parents frequently come to OPD with the concerns of the child is getting recurrent infection. They want to know if there is something wrong with the immunity system of the child. They want to know if there are any immunobooster drugs which you can give them to prevent them from getting recurrent infections. I'm Dr. Chirag Khan. I'm a pediatric consultant with the Rainbow Children's Hospital, Banagata Road. And today I would like to put highlight on some of the common concerns regarding recurrent infections in the children. You see, as the baby is born, baby receives a lot of antibodies from the mother, few across the placenta and few from the breast milk. And in the initial 6 months of life, baby is confined to the house and baby is just exposed to close family members. And because of that high amount of antibodies from the mother and because of lack of socialization, majority of the children would not develop any of the infection in the first 6 months of life. After 6 months, the level of antibodies start to fade away. At the same time, the children from 6 months onwards, still up to the age of around 8 to 10 years of age, they are relatively immunodeficient. You see, majority of the immunity which we receive are determined by a couple of factors. One is our inherent immune system, which no medicines can change. The second portion is the passive immunity which we have received from our mother across the placenta and through the breast milk. And third is the immunity which you received by getting vaccinated. And fourth is the natural immunity which you develop by getting frequent infections. So it is very natural that the children get a lot of recurrent infections in this toddler age group. On an average, a child in the toddler age, in the preschool period and even in the early school period, gets somewhere around 4 to 8 episodes of viral infection in a year. Not because there is something wrong with the child, just because the child do not have so much of exposure to the common prevalent viruses. It takes a couple of infections from each virus for the child to develop enough of antibody level in the blood for child to not get that infection again. The same time, the same viral infection would not infect an adult so frequently. Why is that? Because that adult has undergone that viral infections at several occasions and because of that has enough of antibody level in the blood to prevent that infections from manifesting symptomatically. And because of this relative immunity deficiency, it is very common for children to have recurrent viral infection in the school going period. Many parents have concerns that this thing was not happening in the last 2 years and why suddenly it has been happening at such a significantly higher rate. So you see, majority of these infections happens whenever there is a socialization, whenever there is a gathering. For last 2 years, because of the COVID period, majority of these children are confined to their home. They have not gone to the play group, they have not gone to the school, they are not mingling in the apartment garden areas. And because of that lack of socialization, none of this had the viral infection which they usually were supposed to have. And because of this lack of socialization, it is very natural that once they start mingling this year, once the school has opened, once they are socializing with their parents, once they are socializing with the outside gathering and all, they are bound to get more viral infection this year as compared to the previous year. And because of that, there is a resurgence of recurrent viral infections last 2 to 3 months. In addition to that, we are also seeing couple of viruses circulating like the respiratory syncytial virus, flu virus, parainfluenza virus and lot of dengue cases as well. Because of that, many of the children are getting recurrent fever. Then parents ask us, sir, at what point should we be concerned about the recurrent infection? So I would say that any viral infection or any form of infection that has happened to your child, that had resolved within a period of 2 to 5 days and that has resolved without need of any antibiotic or without a need of hospitalization, usually would not warrant much of the evaluation. A child who keep on getting recurrent infection, each time affecting a different organ system, one time respiratory infection, other is skin infection, sometimes GI infection, and if each episode end up requiring hospitalization or a prolonged duration of antibiotic, and if there are more than 4 to 5 such episodes in a year, that is when the pediatricians usually look for, is there anything wrong with the immune system of that child or not. Then parents usually have another concern, sir, are there any medications that we can use to boost the immune system? I would say that the best medication for boosting the immune system is the breast milk, which usually every child has an opportunity in the initial 2 years. Breast milk provides a lot of antibodies from mother to the babies. There are no other evidence-based medicine which can be given to the children that would lead to boost up of their immunity level. The other way to build up immunity is by getting vaccinated. Because of the COVID period, many children are lagging behind in their vaccination schedule. See, vaccines gives you protections against that particular diseases. Now, getting vaccinated doesn't gives you an assurance that you would not get all the viral infections, but at least it gives you protections against the selected diseases against which we have the vaccine. Now, there are 200 viral diseases which can cause alone cough cold as well as the respiratory illnesses. There are so many other viruses which can cause the GI illnesses. We don't have vaccines against all of them. So if you take a flu shot, it gives you an immunity against the flu virus. But still there are other viral infections which can still happen. But it is very much important for the child to get age appropriate vaccination and to be up to date on the vaccination chart to prevent this recurrent infections from happening. Beyond this, it is just a period of time and usually it would settle down.